Doctor, I just keep getting wheezy and my chest feels tight.
Okay, please tell me more about it.
Actually, doctor, especially at night when I'm going to play outside, it's getting worse and worse since 3 months now. And I don't know why it's going on. I felt like it's an infection, but now it's happening 3 to 4 nights per week.
Mm-hmm. Okay. Uh, do you have something like fever with it?
No, doctor.
Okay. Runny nose,
No, doctor.
sore throat.
No, doctor.
Okay. Do you feel any chest pain?
No, doctor. Just feel tight.
Mm-hmm. Okay. It's only at the night or the whole day?
Mostly at night.
Okay. And do you feel cough with it?
Yes, doctor. I sometimes feel cough and short of breath, and I have to stop in the middle of my play so I can breathe properly.
Okay. Have you seen any doctor for this?
No, doctor.
Okay. Are you taking any medication for this?
No, doctor. I was thinking to take steam to clear up my nose, or I thought maybe it's something infection, but it didn't help me enough. For a while it did, but it didn't anymore.
Okay. What about um, palpitation? Do you feel your heartbeat?
No, doctor.
Okay. And during this episode, you feel chest tightness. Otherwise, it's okay. You feel fine.
Yes, doctor. While playing, only it's feeling worse.
Okay. And
And
what
doctor,
about night?
sometimes
Uh,
the dust when I'm cleaning the room, I felt that dust is also causing me this sometimes.
okay. And you feel these symptoms 3 months back.
Yes, doctor. Since 3 months.
Before 3 months, you were perfect. Okay. Before 3 months, you were perfectly fine.
Yes, doctor.
Okay. And are you allergic to something ex-
No, doctor.
except
Only this
dust,
dust.
as you already told me? Okay.
No.
Okay. Do you mind if I ask you some personal questions?
Sure, doctor.
Do you smoke?
Sometimes, doctor.
How much?
Like 2 to 3 cigarettes every 2 to 3 days.
Okay. Since how long?
Like 1 to 2 years now.
Okay. What about alcohol?
I drink socially only.
Okay. Are you diabetic?
No, doctor.
What about blood pressure?
No, doctor.
Okay. Uh, can you tell me, do you have any long-term illness other than this?
Yes, doctor. I get this hay fever seasonal.
Mm-hmm. Okay. Do you have any surgery in the past?
No, doctor.
Okay. And what do you do for a living?
Doctor, I'm a student
Okay. With whom do you live?
with my parents.
Okay. Do you drive?
No, doctor.
Okay. What is your main idea, Mr. Smith, that what you are having?
Doctor, I think it might be kind of allergy like my brother.
Okay. What is your main concern?
I'm worried about like any attack or getting short of breath like asthma.
Hmm. As I'm here to help you, what are your main expectations from this consultation?
Doctor, I just want to know what's going on with me. Do I need any kind of inhalers?
Mm-hmm. Okay. So, Mr. Smith, I understand your worry. Don't worry, I'm here to help you. As you told me that you are having chest tightness, you feeling chest tightness and wheezing since last 3 months, especially after playing or during playing, and you are
Yes,
allergic to dust, and you are smoking 2 to 3 cigarettes on and off from last 1 to 2 years. Is there
yes, doctor.
anything else you want to add?
No, doctor.
Okay. Do you mind if I examine you?
Sure, doctor.
Okay. So first I check your hands, your pulse, your blood pressure, your all vitals, and I check your eyes for anemia, jaundice, your tongue tip, and your tongue thyroid for by swallowing, and your lymph nodes. And focus examination, I ask you to expose the chest, and first I do inspection, palpation, and then I do auscultation for local parameters, and I do chest expansion, and at the end I do auscultation. Is there any finding?
Res- Respiratory 16, oxygen normal, everything normal except mild expiratory wheeze diffusely. And do
Hmm.
you want to do
Okay.
anything else?
Mm, I I want to do spirometry. Um, is there any finding?
No, it's not available.
Okay. Uh, as Mr. Smith, after your history and examination, um, I think that you are might having asthma uh, because you are having allergy, and you are having history of hay fever, as you are smoker, and especially you are having history during playing episodes, and your chest become wheezy. So, do you know
Okay,
what is
doctor.
asthma?
Yes, doctor, my brother is suffering from the similar condition. So, doctor, I
Okay.
have asthma. Like, is it diagnosed right now?
Uh, no, I we run some few tests for this. First, I advise you some tests like chest X-ray, and we can do flow. Um, I do spirometry and flow check your uh, FEV1 level, FEV1 and this is ratio, and for this I just give you some lifestyle measures, and also I give you some inhalers. Is it okay to you, Mr. Smith?
Okay, doctor.
Do you get it?
Yes, doctor.
Is your brother already taking inhalers?
Yes, doctor.
Okay, so I think it's might easy to you to get it, how to take it. First, as you are a smoker, Mr. Smith, so as you're already allergic and asthmatic, so first you need to try. Do you think or ever think to quit the smoking?
No, doctor.
Okay. Uh, just try to think about it, because I think it's very helpful for you and your asthma just to improve, because it might improve after quitting smoking. And as your daily activities, you are playing or player saucer player or anything else, so before you need to take inhaler. um, you need Firstly you need to take I think,
Mm-hmm.
short acting uh, short acting medications like salbutamol, and
Okay, doctor.
um, and secondly, I advise you inhaler seretide, 2 puffs in the morning and 2 puffs at the night, as your symptoms more worse in the night. uh, you should take at least 3 to 6 months, um, and after that we reassess. I just reassess you, and we just adjust the dose accordingly. And secondly, I advise you just before playing, if you're going you any playing like football or badminton match or anything, before this you can take two
Time
puffs
up.
so that
Time up.
uh,
Okay, next case.
Okay. Next case, case number two.
Okay.
Dr. Iman, just 1 minute. I need to write something.
Okay, doctor.
Um, okay. Case number 2 is with Meena.
Dr. Sumaira, are you there? No, no,
Yes,
no.
yes, yes, I'm here.
It's Dr. Amber, back to back three cases. Then it's your turn.
Okay then. Okay.
Okay, Dr. Amber, your next case is Mr. Abdurrahman, or you can say Mr. Hadi, 58 years old, came to discuss his problem. Please proceed with history, examination, and management plan. Mr.
Hello,
Hadi.
Mr. Hadi. Hello, Mr. Hadi. My name is Dr. Ramreen. How may I help you today?
Yes, doctor, actually, I have sore on my right foot and it's not healing.
Mm-hmm. Please, Mr. Hadi, tell me more about it.
Doctor, actually, I noticed it's like 10 days ago under the ball of the right foot. And initially it was small and then it burst and now it's an open sore.
Mm-hmm. Okay. Mr. Hadi, do you have any fever with it?
Uh, no, doctor. But I feel more tired.
Okay. Okay. Can you tell me about your wound? Is it there is any bloody discharge?
A slight clear yellow, doctor. Yellow discharge.
Okay. Okay. And since how long you tell me? 10 days ago.
Yes, doctor.
Okay. Have you seen any doctor for this?
No, doctor. I just came here for first time.
Okay. And are you taking any medication for this?
No, doctor. I just took paracetamol for the pain, but I don't feel a lot of it. Like it's there. I don't know why it's there.
Okay. Is there any pain?
A little bit when I'm walking. Not too painful.
Okay. Okay, Mr. Hadi. Firstly, do you tell me that are you diabetic?
Yes, doctor. I'm diabetic for now 8 years, and I'm taking medications for it.
Okay. Can you tell me that which medications are you taking?
Metformin, gliclazide, and for high blood pressures, I'm taking Ramipril, atorvastatin, and aspirin.
Okay. Okay. Is your blood sugar under control?
Doctor, last time I went 6 months ago, it was 78 millimoles.
Okay. Have you done your HbA1c?
Yes, doctor, it's 78 millimoles.
78 millimoles. Okay. Since how long you have done this?
6 months ago.
6 months ago. And during these 6 months, you didn't retest.
No, doctor. I'm just
You
taking my
and you
medications and
didn't.
I go for like annual checkups.
Oh, okay. And you didn't check any blood sugar at home.
No, doctor.
Okay. Okay. Can you tell me more about your wound?
Yes, doctor. I told you like discharge and pain sometimes. And what else, doctor?
Is there any other wound
No, doctor.
on the body?
No, doctor.
Okay, okay. And before 10 days, there was no wound?
No, doctor.
Okay. And there's no fever?
No, doctor.
Okay. Do you have any urine problem?
No, doctor.
Okay. And what about your VN?
It's fine, doctor. I don't feel anything.
Okay. Do you feel any sensation in your body, or you feel that your sensation might be decreased on your foot and you didn't feel it? Is it so?
Yes, doctor. I don't feel any pain, even though this is a deep ulcer. So I'm not sure what's going
Mm-hmm.
on with it.
Mm-hmm. Okay. I am sorry, Mr. Hadi. I understand your situation. It might be very worrying. I'm here to help you. Can you tell me that do you have any other long-term illness other than diabetes and blood pressure?
No, doctor. Only this and high cholesterol. So I'm taking medication for that also.
Okay. Do you have any surgery in the past?
No, doctor.
Okay. Is there any family history of diabetes?
Yes, doctor. My father had diabetes and he died because of some leg. He died after a leg amputation.
Okay. Okay. I understand. I'm sorry. And what about what do you do for a living?
Doctor, I'm an accountant and mostly it's a sitting job.
Hmm. Okay. With whom do you live?
I live with my wife and 2 kids.
Okay. Do you drive?
Yes, doctor.
Okay. Okay, Mr. Hadi. What is your idea you might having as you are worrying about it?
Doctor, I just probably it's because of my diabetes.
Hmm. Okay. And I understand, but what is your major concern?
I'm concerned that I'm worried about losing my leg like my father.
Hmm. I understand. Okay. As you're worrying, I'm here. I understand your situation. What are your expectations from this consultation?
Doctor, can you just I want it checked and treated and I want to know like how to stop getting it worse.
Hmm. Yes. Okay. I'm here to help you. As Mr. Hadi, you told me that you are having one deep ulcer on your foot, and with whom there's a slight yellowish discharge, and you feel slight pain in it, and you feel it 10
Yes,
days before. Is it so?
yes,
Anything else you want
yes,
to add?
doctor. No, doctor.
As you are diabetic and having blood pressure and high cholesterol, and you are taking medications for this.
Yes, doctor.
Okay, do you mind if I examine you?
Sure, doctor.
Okay, as I do general physical examination, I check vitals, and I check anemia status, any jaundice, and um, thyroid, lymph nodes. And for focus examination, I do a local wound examination, and I do sensations, sensory
Mm-hmm.
sensation of the foot, and I can do foot examination for the wound.
Okay,
Inspect.
what else will we you will check?
Uh, I do sensations, do reflexes, and I can do check power.
Okay, I'll pause the timer. Dr. Imran, please pause the timer and I'm sending the picture in group.
Okay, okay, pause the time already.
Dr. Amber, can you check the chat?
Yes, I'll check it. Okay, Mr. Hadi, I'm sorry, I didn't ask. Do you smoke?
Yes, doctor, I'm smoking like 20 cigarettes a day for 20 years now.
Okay. And what about alcohol?
I drink occasionally.
Mm-hmm. Okay. After Mr. Hadi, after examination and according to your history, as you are also know you are diabetic and your concern is your main ulcer on the foot. You are having diabetic foot. We do you understand what is diabetic foot?
No, doctor.
Okay. As you are having um, long-standing diabetes, and after diabetes, as you know, diabetes is a multi-organ disease. Diabetes involves many organs of your body. So, and whenever you're having infection or a wound on your body after diabetes, it might take a very much long time to heal, especially, and we need to very much take care of that wound, because if it gets secondary infection, then it's as you have already history of amputation and of your father, you understand,
Yes, doctor.
do you get it?
Yes, yes,
So
doctor.
I'm worried about your wound. So, I'm here to help you. First, we need to control your blood sugar as you are taking your medications, but still, we need to strictly monitor your blood sugar. And as what about sensations on the foot?
Reduced.
Reduced. Okay. As your sensations are reduced on examination and you didn't feel any very much pain on your ulcer, so we need to take medication for this. I just are you taking any medication like um, gabapentin or pre?
No, doctor. No other medications.
Okay. Okay. Just we need to adjust your medication and just for your sensory decrease sensation on your foot. Mr. Hadi, for this, I refer you to the consultant and specialist, and your diabetes control. I refer you for the to the dietitian. So your diabetes must be under control, and your for your diabetic foot, you must need debridement and very much take care of this. So I refer you to the hospital for this. Do you get it?
Okay, doctor.
And
Dr.
as
Ambreen,
you are
time up.
okay, sir.
So that was the second case for you. Uh, shall we move to next?
Yes.
Yes.
Okay, doctor, next case.
All right. Um, doctor, third or fourth? Fourth case.
Fourth.
Okay. Mr. Daniel, 35 years old male, came to discuss his problem with you. Please proceed with history, examination, and management plan.
Okay, Mr. Daniel. Okay.
Dr. Amber, it's third case for her.
Yes,
Dr.
yes.
Amber.
Okay.
Okay, I
Okay.
thought it's
Yeah.
okay.
Hello, Mr.
Okay.
Daniel. My name is Dr. Ambreen. How may I help you today?
Yes, doctor. Actually, my back feels so much painful these days, and since last week, it's really sore.
Hmm. Sorry, you tell me back pain. You have back pain.
Yes, doctor.
Is it? Okay, Mr. Daniel, can you tell me more about it?
Yes, doctor. Actually, 7 days ago, I started lifting like heavy box, and then I felt pain in the central lower back, and then it was going
Mhm.
down in my sitting area and also to the knees. And doctor, it's really
Mhm.
getting worse when I'm bending or prolonged sitting.
Mm-hmm. Okay. You feel pain 7 days ago.
Since 7 days.
Before 7 days,
7 days
since
ago,
7 days.
I was lifting, yeah, I was lifting heavy boxes.
Mm-hmm. Okay. Okay, Mr. Daniel, do you feel any numbness in your legs?
No, doctor.
Okay. Is there any urinary incontinence? Do you feel any urine discharge?
No, doctor. No loss of control.
Okay. There's any stool incontinence?
No, doctor.
Mm-hmm. Okay. Do you have any fever?
No, doctor.
Okay. Is the pain continuous or on and off?
It's dull like all the time, but it's getting worse when I'm bending or long sitting, and it gets better when I'm lying down.
Okay. After taking rest, it's relieved. Is it
Yes,
so?
doctor. Yes.
Okay. Okay. Are you taking any medication for this?
I took some paracetamol, but doctor, I don't know why it's not going.
Okay. Okay. Okay, Mr. Dania, can you tell me that do you have any you don't have any fever, you told me. Is it so?
Yes, doctor.
Any cough?
No, doctor.
Any headache?
No, doctor.
Any neck pain?
No, doctor.
Okay. Do you mind if I ask you a few personal questions?
Sure, doctor.
Do you smoke?
Yes, doctor. 5 cigarettes a day, and for 10 years now.
Okay. What about alcohol?
Drink socially.
Okay. Is there any long-term illness you have? Do you have
No,
diabetes?
doctor. No, doctor.
Blood pressure?
No, doctor.
Are you asthmatic?
No, doctor.
Okay. Is there any family in your family having heart disease?
No, doctor.
Okay. Is there in any family member having asthma, diabetes?
No, doctor.
Okay. Do you have any surgery in the past?
No, doctor.
Okay. What do you do for a living?
Doctor, I'm forklift operator in a warehouse
Okay. And with whom do you live?
with my wife and one kid.
Hmm. Do you drive?
Yes, doctor.
Okay. What about pain during driving?
It's not aching a lot.
Okay. Have you done any test for this?
No, doctor, no test.
Okay. Have you any visited any doctor?
No, doctor.
Okay. What is your idea that you are might having?
Doctor, I think I pulled my muscle.
Hmm. What is your major concern about your pain?
I'm worried. I'm worried that it might be a disc prolapse or that I will end up off work long term.
Mhm. I understand. What is your um, expectations from this consultation?
I want some advice on exercise, doctor, or do I need any X-ray?
Hmm. Yes. Okay. I'm here to help you. Do you mind if I examine you?
Sure, doctor.
Hmm. First, I do general physical. I check vitals and I check anemia, jaundice, and I can do uh, thyroid examination and lymph nodes and focus examination. I examine back and first I do inspection and then I palpate uh, before asking any pain and palpation and I perform movements, forward bending, backward bending, and if he is okay with it, and I ask him to move for checking gait, normal gait, and
Mm.
um, is there
Okay.
any finding?
Examination slightly stiff, a localized tenderness in lumbar paraspinal muscle, limited flexion due to
Mhm,
pain, and everything
mhm.
else is normal. Straight leg
Okay.
raise is bilaterally negative.
Mhm. Okay. Mr. Daniel, after your history and your examination, uh, first, I think you might have your muscle pull, and you have your muscular pain in your back. And
Okay, doctor.
uh, for this, do you mind if I run some tests for you, just to confirm? And do you get
Yes,
it?
sure, doctor. Yes, doctor.
Okay, I just want to do the X-ray of your back. Okay,
Okay,
and meanwhile, I
pending.
advise. Okay, meanwhile, I advise you to take some rest and advise you some medications, and I refer you to the physiotherapist. Is it okay to you? Do you get it?
Okay, doctor.
Okay. You take a rest and avoid heavy exercises or heavy work. And meanwhile, as you're taking already paracetamol, uh, just continue taking paracetamol 500 milligram, 2 tablets at least 3 times a day. And you can take apply topical diclofenac gel at least 2 times in the morning and evening. So might it get relieved your pain. And I also refer to your physiotherapist. Their physiotherapist might do some exercises just to relieve your stiffness, muscle stiffness. Is it okay to you?
Okay, doctor.
Do you get it?
Yes, doctor.
And after at least come back to me after 7 days. So I assess your pain, and meanwhile, you already had done your X-ray, and I can check your X-ray. And during this period, if you feel increasing in your pain, any bowel or urine incontinence, and you feel any headache, and you might feel any numbness in your lower legs and any other part of the body, just immediately come back to me or nearby emergency. Is it okay to you?
Okay, doctor. Doctor, how long it will take to resolve?
At least, okay. If you done your physiotherapy regularly and you take your medication and take rest, then it resolve in then 7 to 14 days and maximum. Otherwise, might be takes 7 to 10 days. It resolved. Um, do you have anything else to want to ask?
No, doctor.
Okay. And also, do you ever think about quitting smoking?
No, doctor.
Okay. Uh, uh, it's very helpful or is positive that if you think about it to quit smoking, because it might helpful for you um, in your future, and also
Time up.
for your body function. Okay.
Okay, Dr. Amreen. So you had three cases
I'm
back to
sorry,
back.
sir. I'm very
No
bad.
worry, doctor. No worry, no worry, doctor. There is something better to do mistake over here rather than doing over there. So
Yes, sir.
this mistake will not cost you at all, but this mistake will make you to correct the mistake before setting for the original and the actual exam.
Yes, sir. I'm little bit sick already, but I'm
No
very much
worry, no worry.
encouraged to do
No worry.
at least practice.
Okay. First of all, let's start from the case which was sorry, that was newly diagnosed
Asthma.
asthma. So it's a young
Yeah,
patient, am
new
I right?
diagnosis.
So
Yes, yes, sir.
onset, he had a gradually onset for 3 months. pattern where
Yes,
he
yes,
came
sir.
with a wheezing and tightness for 3 to 4 nights per week. Okay, so you
Mm-hmm.
have to ask about what was the pattern, whether he's getting daytime, nighttime, and he was
Yes,
getting
sir.
this breathing difficulty when playing side football match, and he stopped because of his breathing issue. Trigger, exactly. Relievers, associated, everything you have to cover. You covered. When past medical history, have you asked about anything about past medical history?
Mm, sir, I asked, but he said only 3 months before he was perfectly fine.
Okay. Okay, and the family history. Doctor, I have noticed in all three cases, you are taking irrelevant family history. Irrelevant family history means like, say, do you have anyone suffering from the same problem like you? This is a family history, doctor. This is not a family history when you're talking
Okay.
about cardiovascular or about diabetes. This patient is not a diabetic or cardiovascular issue, so you should not go into that details. Okay. And
Okay, sir.
moreover,
Sir,
you're
we need
asking
to ask
whenever.
in every case. In every case, we
Uh,
don't need to ask diabetes, blood pressure.
No, 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 no. It's not like this. Okay. This is again, we call it, misunderstanding and some sort of, misinterpretation is there. Why we are asking family history? Because we wanted to relate anything which might run in the family, which is related to this
Okay.
patient's current problem.
Okay.
You got my point. Same goes to the
Yes, sir.
past medical history also. It might be correlated with this patient. Like say, this patient is asthma, so maybe hay fever, maybe patient having eczema, atopy, or any family history of asthma or anything. Okay. Then social, psychosocial, why it is important? Because in this case, why we have to relate that one? Because we have to see what kind of profession patient is having, and what kind of hazards or potential, reason will be there to take care of his asthma. Am I right? If I'm
Yes.
suspecting. So you are asking red flag, very good thing, doctor. Differential, but one or two differential, one or two red flag. That's it enough. Okay, don't go
Okay.
with a tick mark kind of style. Okay.
Mm-hmm.
And have you summarized this case?
Uh, yes, sir.
Okay.
Okay.
Um, Investigation, doctor. Here, what you have to tell that patient while doing the examination, peak expiratory flow. Because peak
Yes.
expiratory flow is not a part of
Okay.
exam
Expert.
investigation. This is a part of examination.
Okay.
Okay, and management always you have to explain about this chronic inflammatory condition of the airways with a variable narrowing and explain the trigger, Mr. Khan, that as you see that you are getting this problem at the night time. So you have to see why he getting nighttime problem. Maybe he's having rugs at home, maybe he's having carpet at home, maybe he's having pet which is sleeping with
Okay.
him, or maybe he's having parrot or something, or any sometime patient SP will be not giving anything, but he will say, Doctor, on my window there is a pigeon's nest.
Okay.
Okay, you have to ask. Okay, where he is
Okay.
getting. But what is the difference between occupational and this one? Because occupational patient will be getting only problem on weekdays, not on weekends.
Mm,
Okay,
okay.
but this case doctor is a young patient, so you have to start first medication and then you have to refer the patient. Okay, now
Okay.
we are having, new guidelines are there. We have to start from low dose inhaled corticosteroid ICS as a preventer and beclomethasone via what we call it reliever. Okay, and you can give short
Okay.
acting beta
Reliever.
SABA reliever before play because he's a
Before play,
footballer.
sir. Sir, please repeat.
Yeah, he's a put forward bowler, so you have to use for 15 to 20 minutes agenda here to explain how to use inhaler properly. You have to teach the patient inhaler technique.
Okay.
Okay, and provide written asthma action plan. These are the two mandatory things. If you are not doing this one, it will be considered incomplete station.
Okay.
Okay, it will not cause a fail, but we call it incomplete. Safety netting and your
The asthma
close-ended questions
management
are not there. Yes,
seems to be
doctor.
very difficult, sir.
No, no,
Asthma
I'm not.
management.
So what do you feel, doctor? What is the problem you're getting?
Sir, what investigations? Is there any investigation I need to tell him
No, for
that he
that one
should do?
you have to tell the patient, Mr. Khan, I am just going to refer you for the specialist, lung specialist. Doctor, why you want to refer from a lung specialist? Because he will be doing your spirometry. That is a mandatory part,
Okay.
and I will be repeating your full blood count and CRP.
Okay.
Okay, at your level, and peak expiratory flow already you have done. Okay, now
Okay.
important thing from your side as a GP, that we have to explain that inhaler technique and asthma action plan. There will be a
Yes.
paper, just simple paper will be the white paper, nothing is written. Just imaginary, you can see that Mr. Khan, I'm giving you this asthma action plan. You have to go and read it. If you have any questions and query, come back to me. Okay, Dr. Amir.
Okay.
So what is
Sir, with
happening? So
medication, sir,
medication.
initially we start lower dose inhale corticosteroids.
We
We should
couldn't,
tell him that you should start.
yeah, I'll be starting from low dose inhaled corticosteroid. But in pediatric cases, doctor, again, we will be giving SABA and we are referring the patient for further management. But new guideline says
Okay.
again that you can start one that one, but still we are having some sort of, we have to follow as per the GP protocol, that we have to tell the patient that I'm going to start this. But don't forget to give asthma action plan. Again, asthma action plan is nothing. You don't have to explain that this is asthma action plan, this will happen this way. No, because it's lengthy. It will take 10 to
Mm.
15 minutes to explain to the patient. Okay. But since
Yes.
you deliver this sentence that I am going to give you this asthma action plan, examiner will be happy that you given that asthma action plan. That's it. He's not going. They are not going to ask you.
Okay.
There is no agenda to ask what is asthma action plan, doctor.
Okay. Okay. We just need to counsel and just tell him that I refer for this. You should
Yeah.
do, and there they tell the management about it.
Yes. Now, doctor, your next
Okay.
case is diabetic foot a problem with the
Yes, sir.
type 2 diabetes. He is a already established patient, so you have to ask about the compliance after HOPI with the medication.
Mm.
Whether he
Yes.
or she is compliant to medication or not, when was last investigation done, okay, and what are the problems he is
Yes.
getting now. He is having some noticing that um, uh, some sort of blister, and it burst, and now it's open sore, means like a diabetic foot sore is going on. So here we have to
Yes.
know about whether patient is compliant to the medication or not. If patient say, doctor, I'm
Okay.
not taking the medication, then agenda will be here again. I have to teach him about that, dangers and, red flags of not compliant to the medication. Number two, doctor,
Okay.
if like say patient says, doctor, I don't like the medication, then we have to ask why you don't like the medication. Maybe patient don't want metformin, the reason because of a stomach upset. So we have to address that issue. Maybe patient is taking this sulfonylurea, maybe patient having dizziness or drowsiness. So you have to adjust the dosage or you have to change the salt.
Okay. So
Okay.
for this,
Now,
we should do this or we should refer for this.
no, doctor, first of all, let me tell you, you are going to refer this patient for diabetic foot ulcer, not for this one. This is your domain.
Okay.
Okay, because
Okay.
patient is taking only two drugs and
Mm.
his HbA1c was 7.8. Okay,
Mm.
6 months ago, it means now it is time to repeat. Okay,
Okay.
father had a complicated type 2 diabetes and died because of leg amputation. So it means there is a strong
Oh,
indication that patient is worried about his amputation too. Okay, so addressing the
yes.
eyes and concern, that is another important part where you have to you have to ask about strongly and carefully with the eyes. Okay, and later on in the management you have to address the eyes. That you say that Mr. Khan, yes, you are thinking that this problem is because of the diabetes. Yes, Mr. Khan, this is the problem because of your uncontrolled diabetes. Are you getting me? Since you are not taking the medication on time, so poor sugar control will lead to such kind of source in our peripheries, like say our foot, specifically in our foot. And you're concerned, you're thinking that you might be losing your leg like your father. At this point, I'm good news is that one. It is not that one because you are on the time. So we are going to treat you on the time. So it is a very small and localized area. So it will be treated with good care and as well as good compliance with the medication. Are you getting me, Mr. Khan? Yes, doctor. Okay, I am really happy to see that you mentioned about these things, so I'm a bit relaxed. That's really great, Mr. Khan. So now, as you expected me to check and treat it, and just wanted to know, and after that summarize, and then you say, Mr. Khan, may I examine you? Okay, doctor, what you want to examine? I'll be doing your general physical examination. I'll be checking your, from a head to toe. You have to explain properly, and then after that, you have to tell that, Mr. Khan, I'll be checking your foot. But before that, I'll be exposing you, okay, up till middle of
Okay.
the thigh.
Okay.
Okay, exposing your both legs, not one leg, doctor. Okay, for example, you are doing only examination of one leg, but which is also complete examination. There is no flaw. Still, it will be considered incomplete. The reason because for that one, for the limbs, you have to do both examination. Okay, if you're not doing just
Okay.
verbalizing, also examiner will think that okay, yes, you Dr. Ambreen did examination. Okay, you can say, Dr. Mr. Khan, I will be checking your normal limb and unaffected limb together. Okay, is that okay for you? And you examine. Now, diabetic foot ulcer, doctor, you have to make sure that you are going to lift up the patient leg and going looking at the heel. Even though if you did whole diabetic foot examination, but you didn't lift up the heel and you didn't look down of the heel or that Achilles tendons area, it will be considered incomplete. Okay,
Okay.
examiners are they are very carefully looking for diabetic foot ulcer because here more
Mm.
chances to lose the station on small mistakes. If you didn't did sensation, if you didn't check that patient's proprioception, okay, so examiner will not give you the finding.
Okay.
Okay, so immediate management for this patient was diabetic foot ulcer, patient likely a neuropathic, okay, with a simple some ischemic component was here. So we're going to start oral antibiotic as per the local guidelines and uh, and some sort of what you call it, you should not put the weight on affected area, okay, appropriate footwear and considering the temporary walking aid. Okay, this is our agenda as a immediate management. Urgent referral to multidisciplinary like say diabetic foot ulcer and podiatry or and a specialist to control the diabetes if patient having uncontrolled diabetes. Okay, and you are going to tell that I'm arranging regular dressing of your foot and pressure offloading in community clinic, or I will be assigning one person. Okay, or you can come to my clinic. Okay, now
Okay.
doctor, when you see that optimizing that diabetes and risk factors, so let's have a little bit look on that one. We're going to review the diabetic control. As you see, Mr. Khan, I can see that your sugar control is not good and you're not taking medication on time. So shall we discuss on that one? Okay, doctor. So for that one, Mr. Khan, I'm going to repeat the investigation. Is that okay for you? What investigation, doctor? I'll be doing full blood count, your fasting blood sugar, HbA1c, and after food postprandial blood sugar, and cholesterol level with liver function test and kidney. Is it okay for you? Yes, doctor. Okay, once report will come back, then we will be adjusting the medication dose. How it sounds like. Doctor, sounds good. That's really great, Mr. Khan. And you can say that I was looking at your BMI, which is on a higher side. So, shall we discuss on that one? Okay, doctor. So, Mr. Khan, as you see that you're suffering from the pain, but still you can go with little bit walk and activities with walking it. How it is okay? Is it okay for you? So take the permission. We are not going to order. We are going to take permission and we are going to request them. Then, as I see that your blood pressure on the higher side, and you told that you are taking the Ramipral tablet, but you are taking on and off whenever you're getting headache, Mr. Khan. First of all, let me tell you, the blood pressure medication should not be taken as in intervals. You should take the medication on daily basis. Okay, if you're controlling your blood pressure, it will be good for you, and you will not be getting non-compliant with the medications. Are you getting me, Mr. Khan? Okay, continue your cholesterol tablets and blood thinning medication as indicated. And since you are smoking, so I'm giving you the smoking leaflet. Okay, once you have a plan to stop smoking, you can come back to me. Then we will be talking on that one. We have to talk a lot on that one. Is that okay for you, Mr. Khan? Okay. Now, Mr. Khan, I'm giving you this leaflet for diabetic foot care. Okay. This leaflet includes that how to inspect your foot and how to inspect between the toes and how to take, family help, or if like say you don't have any family member to take care of that one, you can put your put a mirror in front of you and you can see it. Is that okay for you? As just I'm writing, I'm just advising you on footwear. It will be helpful for you, and well-fitting shoes will be there, and you will be able to walk properly. Then foot hygiene, doctor. So you have to say that you have to keep moisture your foot and don't wear the shoes and wear cotton socks if it is mandatory. And if like a patient having over-the-counter corn plaster habit, okay, so you have to tell them you should not use over-the-counter that corn plasters. And if your symptoms getting worse, since you are running short of the time, so you can say since your if in case if your symptoms are getting worsen or you won't get worsen, please come back to us. Is that okay for you, Mr. Khan? Is there anything else you wanted to tell? No, Mr. No, doctor. Thank you very much. So that's what you have to go for. Diabetic foot patient. Diabetic foot is not a simple case. Doctor, diabetic foot is a very complex case. You look
Yes,
very
sir.
simple, but it is very complex. Okay, do the practice. You will be getting more and more. Okay, and now your patient.
Okay.
Next patient was a mechanical back pain. A young patient, 35 years old gentleman, having heavy talks, lifting, and pain having 7 days. So you didn't ask about sight. Mr. Daniel, may I know where is the pain? Doctor, here. He will be mentioning that, okay, central lower back pain. Since you didn't ask the pain, so Socrates was incomplete. Though you asked about the nature, you asked about the severity
Oh,
and other temporal signs. Okay. Now, associated red flags and screens, you gone through very well. So you ask about red flag. That is your good point. Past medical history, but again, family history, you're taking a dragging a lot. Here, there is no role of asking
okay.
family history of the heart problem, family history of asthma, or anything. No, doctor. Is there anyone
Okay,
suffering
sir.
from this kind of illness in your family? That's it. No, doctor. Okay.
Okay.
Any chronic medication? No, doctor. Okay. Now switch to psychosocial. What do you do for living? Your psychosocial again, doctor, you have to take in a row. What do you do for living, Mr. Khan? With whom you live? And how about your diet? May I know, have you checked your weight according to your height? Okay. And what about smoking? And about alcohol? Okay. That's it. Recreational drug doctor, here you can ask. If you're not asking, so no one is going to ask you anything. Okay, everywhere if you're putting the recreational drug, it is a lot of time taking. Then he was thinking that he pulled a muscle. Okay, and sometime patient will be he wants some exercise. Sorry, this test. There is no screening test needed. Okay, there is no X-ray needed. There is no blood investigation needed. Doctor, you have to reassure the patient.
Okay, sir. If patient asks,
No, for that one, you have to say that this is a mechanical back pain, Mr. Daniel. From like X-ray, you will not be getting any finding, but I'm giving you this medication. If like say your symptom is not getting better, we will reconsider that investigation. Is that okay for you?
okay,
Okay,
sir.
here examiner wanted to see how cost effective and how cost saving person you are.
Okay.
Okay, that's it from my side, doctor. So, doctor, from your side now.
Yes, doctor, I have not jot down few things. Like in asthma case, Dr. Amrit was exercise-induced asthma, so PFR will be done before and after the exercise to know how much it is
Okay.
deranged. Yeah, and SABA is not
Every time,
morning, evening.
every after every
No, no, no,
exercise.
no, just to diagnose the case on the primary
Okay.
care. Secondly, you're
Okay.
not going to give morning, evening SABA, just two puff before the exercise and even after if he needs it. And I saw like if in general we see an asthma case triggers, family history, drug history if he's taking any NSAIDs, PFR on the examination is needed, asthma action plan with inhaler technique. Uh, this is what we cannot forget in this case. And young patient with asthma, so first differential will be breathlessness. So first differential will be asthma. And again,
So,
as asthma is there, so occupational and exercise induced should be there in your mind.
okay. Exact diagnosis is exercise-induced asthma.
Yeah.
Okay.
Okay. And the impact is was missing in this case, impact on his life. Because of this, he was avoiding
Okay.
playing,
Yeah. Yeah.
etc.
Yeah.
Um,
Okay.
and moreover,
It could be.
you were forgetting privacy and chaperone in every case, and safety netting in three cases. Okay.
In
And
two
for
cases, time
diabetic foot,
management, and
yeah,
in
for
every case,
diabetic
we
foot,
need to tell about
yes,
chevron during examination.
yes, yes. For privacy and chaperone
Okay.
is needed in every case, no matter even the eye or ENT.
But doctor, if the patient is female, I'm a female doctor and patient is female, still I need chaperone.
I'll tell you one thing there, sometimes even male SP or female SP, what we can do is just memorize one sentence. In the presence of complete privacy and chaperone, I would like to do your examination because there, station to station, you don't get to understand if the SP is female or I should say this or that. So there should be a reflex and you can say it in
Okay.
every station. If you say chaperone, it's not negative marking, but if you don't say, then yes, you will lose marks.
Okay.
Okay, and for diabetic foot, firstly he said I have ulcer on my foot. First thing you will say, can I see it? Because we need to see like they will show you the picture right
Okay.
away. Or if you still want to go
During
with the
history.
history, yeah, you can ask either in the first place
Okay.
they can show you, or in the examination is fine also. But I think it's preferable to see before. And you can ask for the ulcer since when and what medication. For any chronic patient, keep few things in mind like medicine, they're compliant on it, red flags, like any blurry of vision along with any any blood in the urine. Okay. Meanwhile, diabetic foot, ask for
Okay.
barefoot walking and footwear. And examination
Okay.
is in detail, so we have to, as Dr. Imran said, we have to go for every detail examination in diabetic foot. And for chronic cases, we will be repeating all the labs if he hasn't done it yet. And in management, blood glucose charting, diet is very important. He wasn't avoiding sugars, along with lifestyle
Okay.
and cleaning of or yeah, clean of the wound. Third case was back pain. Occupation is very important at the beginning. You can ask, and impact was important. Was missing in this case. S- Straight leg raise test is mandatory in back pain cases. You didn't do, but I
Okay.
gave you the
Okay.
finding. And X-ray is not needed as okay. And follow-up is for 2 to 4 weeks. It won't get better in 2 weeks. It will take 2 to 4 weeks or even 6 weeks sometimes. That's all from my side.
Okay,
Thank you,
Dr.
ma'am. Thank you, sir.
Thank you.
So, Dr. Sumaira.
जी अस्सलाम वालेकुम.
Walaikum salam, doctor. So, doctor, I think case number 3.
Yes, Doctor. Case number 3.
Okay.
Your patient, Mrs. Helen, 46 years old female, came to discuss her problem. Please proceed with history, examination, and management plan. Sorry, Mr. Helen.
Mr. Helen, 46 years old.
Yeah.
History examination. Okay, let me know when to start. Okay.
Okay, doctor, start.
Okay.
बहुत mistake थी.
Hello, Mr. Helen. My name is Dr. Sumaira. Please tell me how can I help you?
Thank you.
Doctor, I have this really painful rash on my chest and back.
Okay. Sorry to hear about it. Please, can you tell me more about it?
It's doctor really painful. I cannot even wear my shirt, and it's so much painful that I feel burning all the time. It's since 3 days.
Okay. Can I see the rash, please?
Yes.
Okay,
Dr.
holding
Man, I'm
holding
sending
time.
you.
Yeah, yeah.
Okay.
Okay.
Okay, okay. Seen. Okay, Mr. Helen, you are saying for the last 3 days you are having this rash, right?
Yes, doctor.
On the chest and on the back. Which side? Right side or left side?
Yes, right side.
Right side. Okay. Apart from this rash, are you having any other complaint?
No, doctor, just so much pain and burning. I don't know what's wrong with me. I cannot sit straight, lie down, or even the clothes are paining me.
I'm so sorry to hear about your suffering. I want to ask few questions. Like, can you tell me this was sudden or gradual?
Doctor, I don't remember how, but as soon as I saw it was getting red, and then these vesicles appear on it, and now it's painful.
Okay, and is it spreading anywhere else?
No, doctor.
Okay. Tell me that is there anything which is relieving this pain?
No, doctor, nothing is relieving. Literally, I'm just dying of pain.
Okay. And okay. Sorry. Do you have any fever?
No, doctor, but I feel so much fatigued.
Fatigue. Okay. Do you have any neck stiffness?
No, doctor.
Okay. Please tell me that do you have any long-standing illness like high blood sugar?
No, doctor. No long standing.
No. Okay. Are you taking any medication on long-term basis?
No, doctor. Sometimes
Any
I
over
take this Brufen.
profen for what?
Sometimes I get headaches and body aches. That's why.
Okay. Sure. Okay. Tell me that in your family, does anyone have the similar illness?
No, doctor.
Do you remember that in your childhood, do you have any chickenpox infection?
Doctor, I don't remember.
Okay. Um, okay, tell me that what do you smoke?
Yes, doctor.
How much? How many cigarettes and since how long?
I've 10 cigarettes since 10 years.
So, Mr. Helen, do you know that smoking is very injurious to health? Have you ever thought of quitting it?
No, doctor. I'm used to it now.
Okay. So what we will do is that I'm giving you a leaflet regarding the smoking cessation. Go and give it a read. And if you ever think of quitting smoking, then we can have a session on it. Is it okay with
Okay,
you?
doctor. Yes,
Okay.
doctor.
And tell me, do you drink alcohol?
Occasionally.
What do you do for your living?
Doctor, I'm a teacher.
Okay. And so this condition is impacting your job.
Yes, doctor. I just took 2 days leave because I wasn't able to even go there with this pain.
Yeah, I can understand. It must be very difficult for you. Okay. Tell me that what about with whom you live?
I'm living with my husband and two children.
Husband? It was Mr. Helen. अच्छा.
Oh,
Um,
right.
अच्छा ठीक है. अच्छा, tell me that what is your typical daily diet?
Doctor, I'm taking a normal balanced diet.
Do you do any physical activity?
No, doctor.
Okay. So Mr. Helen, can I examine you?
Sure, doctor.
One more thing. One more thing. Which thing is crossing over your mind?
Doctor, I feel like someone at work said it might be some shingles.
Okay. And which thing is worrying you the most?
I'm just worried that it might go to my children.
Mm-hmm. Okay, it's a valid concern. Okay. And what are you expecting from me today?
I just want any confirmation or treatment for pain. And can you manage it, doctor?
Sure, sure. I will definitely tell you about it. So Mr. Helen, you are saying for the last 3 days you are having this painful rash on your chest and back, and you are thinking that you are worrying because it can transfer, it might transfer to your children, and you want me to give some medications for it, right?
Yes, doctor.
Okay. So can I examine you now?
Yes, doctor. What else?
So first of all, in the presence of privacy and chevron, I would like to do general physical examination, BP, pulse, temperature, respiratory rate, and BMI of the patient. Then I will check. I will ask the patient that, okay, can you please remove your shirt?
Okay, doctor.
Then I will inspect the rash, and then I will check the eyes. I will palpate the lymph nodes, and I will like to check the pedal edema.
Okay, everything is fine. Patient afebrile is stable except the rash shown in picture.
Okay. So, Mr. Helen, on the basis of your history and examination, what I think is that you are having a condition which we call as herpes zoster or shingles.
Okay, doctor.
Yes. Do you know about it?
No, maybe it's kind of infection.
Yes, that is why I am asking you that in your childhood, do you have any history of chicken pox? Because in most of the people, when they have a chicken pox infection, it get stay in your body, and then after many years it reactivates, the virus reactivate, and it causes this kind of rash. So if anyone has the low immunity, any kind of low immunity, they can it can this type of rash can happen in them. Okay, but
Okay.
we have a treatment for it. What we can do is that, one more thing is that, do you have a rash on your nose?
No,
Sorry
doctor.
to and in your around the eye?
No, doctor.
Okay, so what we can do is that we can give you oral acyclovir 800 milligrams 5 times a day. Okay, you have to take this medication for 5 days, and this medication usually causes nausea, vomiting, and tummy pain. Okay, and
Okay, doctor.
try to wear loose cotton clothes, airy clothes. Don't touch the rash, and try to stay take you can take bath if you want. Try to stay in the cool, you can apply calamine lotion on it if you want, if you have so much itching. And uh, if you want, you can go to your work, because since it is covered with clothes. But if you want, I can write a sick leave to your employer. Okay,
Mm-hmm.
and you can come to me after 1 week. And in between the 1 week, if you feel that your rash is not subsiding, it is getting worse, or you are having fever, or you are having rash on any other part of your body, like nose, around the eyes, face, then in that case
Mm-hmm.
you have to come to the emergency. Are you getting
Okay,
me?
doctor. Yes, doctor.
Okay. And do you have any other question?
Doctor, sometimes it's very itchy, so only lotion can help me.
Yes. What I can do is that, it is affecting your sleep also.
No, no, doctor.
So, okay, I'm giving you a one tablet, loratadine, which you can take in the daytime. But if you feel that, you can take for 5 days.
Mm-hmm.
Okay. And if you have nighttime irritation, nighttime problem, itching, difficulty in sleeping, you can take tablet for chlorpheniramine at nighttime also. It will help you to, give sleep. It helps you to sleep also, and it will reduce your itching.
Okay, doctor.
Okay. Okay.
Doctor,
Okay.
my
Thank you.
wife is, I feel like my wife is pregnant.
Okay. Thank you for coming. Your wife is pregnant. I didn't ask about the wife.
Okay,
If the
doctor,
wife is
time
pregnant,
up. So, next
then
case.
okay. Okay, okay, okay. I think in pregnant wives, then we have to start the treatment also in that. Okay, we will discuss later. Okay, next case.
Okay,
Yes,
so doctor, case number 5.
Yes, case number 5.
yes.
Okay, Mr. Ravi, 60 years old male, came to discuss his problem with you. Please proceed with history, examination, and management plan.
Mr. Ravi,
Yes.
60 years old, history, examination, and management. Okay, when 2 minutes are left, now let me know just. Okay, if
Okay,
possible.
doctor. Yes, doctor.
Okay, thank you, thank you. Okay, should I start?
Yes, doctor, start.
Okay,
Okay,
Mr.
I'm
Ravi,
sorry. Just
Mr.
one
Ravi,
minute.
I heard a laughing sound. Okay, should I start? Let me know when to start.
Okay, doctor, start.
Hello, Mr. Ravi. Good afternoon. My name is Dr. Sumaira. Please tell me, how can I help you?
Doctor, I just keep getting this tightness in my chest when I walk.
Okay. Please tell me more about it.
It's been since 3 months, and I'm feeling this intermittent symptoms. Whenever I'm walking up hills and climbing to flights of stairs, then my chest feels centrally tight.
Okay. Sorry to hear about it that you are having this symptom. Please tell me that this you are saying that when you walk and you have pain or tightness.
Central tightness, doctor.
Okay, central tightness. So, is it on rest also, or only when you walk?
Mostly when I'm walking.
Is there any pain also in your chest?
No, doctor.
Any shortness of breath?
No, doctor.
Any blurring of vision?
Yes, doctor. Sometimes I feel this slight shortness of breath, but no blurry vision.
Okay. Um, okay, tell me that do you have any are you using any medication on long-term basis?
Yes, doctor. I'm hypertensive and I have this high lipids and also sugars for 5 years, so I'm taking medications.
So
Metformin,
for your,
Ramipril, and statins.
tell me that your high blood pressure is controlled on Ramiprin,
Yes, doctor.
and what about your sugars are controlled? What is your last
Yes, doctor.
HbA1c?
It was 7.5.
7.5. Okay, and what about your lipids? What you are taking for lipids?
Atorvastatin 20 milligram.
Okay. Um, okay, tell me, do you have any leg pain when you walk?
No, doctor.
Any problem during intimate relationship?
No, doctor.
Okay. Um, tell me, do you in your family does anyone have a history of any heart disease?
My father had this heart attack at age 55.
Okay, sorry to hear about it. And how is he now?
Doctor, he died of it.
Okay. Uh, okay, tell me that do you have any other, do you smoke?
Yes, doctor, 10 cigarettes a day for now 10 years.
So have you ever thought of quitting smoking?
No, doctor.
Okay, so I'm giving you a leaflet regarding the smoking cessation. You give a read at home, and if you ever feel that you want to quit, we can have another session on it. How about that?
Sure, doctor.
Do you drink alcohol?
No, doctor.
What do you do for your living, Mr. Ravi?
Doctor, I am a salesman.
Okay, so is this condition impacting your job?
Yes, doctor. Actually, whenever I'm walking, like even 5 minutes. Sorry, this chest tightness stays for 5 minutes, and then when I'm resting, it gets better. But I have to stop midway of my work.
Okay. Uh, sorry to know about it. And with whom you live?
Doctor, I live with my wife.
Okay. Tell me about your so because of this problem you can't do any physical activity, right?
Yes, doctor.
And what about your daily dietary routine?
I'm taking junk food mostly, and doctor, I cannot control on sweets.
Mm-hmm. Okay. And what about what is your BMI weight according to your height?
29.
29. Okay, so which thing is crossing over your mind?
Doctor, I think maybe it's because of my heart.
Because of your heart. Okay. And which thing is worrying you the most?
I'm worried of a heart attack, and I'm worried about my family and work also.
Okay, okay, right. I can understand. It is a valid concern. And what about your, what are your expectations from me today?
I just want any test to check if my heart is fine or anything to stop this chest tightness and pain.
Okay, sure. I will definitely tell you about it. And so this condition is impacting your job and life. Okay.
Yes, doctor.
So let's summarize. So, Mr. Ravi, you are having a chest tightness since last 1 year, I think. 1 year you are having this chest tightness, and you are thinking it might be, you are
3 months.
thinking, sorry,
3 months. 3 months.
3 months. Okay. And you are thinking it might be there is, you are worried about the heart attack, and you want me to give you some test. Okay. So,
Mm.
Mr. Ravi, I want to examine you. Can I examine you?
Sure, doctor.
So, on the basis of history, on the basis of complete privacy and chiffon, I would like to do first a general physical examination of the patient. I would do the vitals, pulse, blood pressure, temperature, and respiratory rate. Then I will auscultate the patient's chest, palpate and auscultate the patient's chest, all the four areas. Okay, and then I will check the carotid pulsation of the patient. नहीं, first I will ask the patient to take off the shirt. उसके बाद then I will check the pedal edema, and I will thank the patient, and I will alcohol, I will sanitize my hands. So Mr. Ravi, on the basis of your history and examination, what I think that you have a condition which we call angina, stable angina. Do you know about it?
No, doctor.
Okay, so basically, there are blood pipes in our heart. Whenever the blood pipes are clogged or there is a buildup of fats in it, we have this kind of symptoms. Okay, for that, I will give you one medication, which is a GTN spray, or it is a GTN tablet also, which you 0.5 milligrams, which you have to take whenever you have pain, right? It will cause some dizziness. And I'm also giving you aspirin 75 milligrams once a day. Mr. Ravi, whenever at home, whenever you feel that you are having pain, you can take one tablet. You have to wait for, you can wait for 5 minutes. And if your pain will not subside, you can take a second tablet. Are you getting me?
Yes, doctor.
And after 15 minutes, if your pain doesn't subside, you can call the ambulance and you can come to the emergency. Meanwhile, I will ask you to,
Two
quit,
minutes, two
try to quit.
minutes left.
Okay. Meanwhile, I will ask you to quit smoking, take a healthy diet. Okay. Try to do a light yoga if you want, if you can. And if you are you drive, do you drive?
Yes, doctor, I do.
So if whenever you feel during the driving that you are having symptoms, you can stop driving, and you can come to me after 1 week. And if in between that, if you feel that you are having uh, the symptom you have having severe chest pain, loss of consciousness, shortness of breath, then you have to come to the emergency. One more thing is that, Mr. Ravi, I want to give you write some investigations for you. Like I want to
Okay.
give you like what serum lipid levels, HbA1c, one chest X-ray, and one ECG. Is it okay with you?
Sure, doctor.
Okay. Thank you for coming. I don't know how much time is left.
Okay, doctor,
Okay.
1 minute left actually.
Okay. So do you want to ask anything?
Doctor, how long should I take these medications?
You have to take these medications whenever you have symptoms, whenever you have pain. Okay. And after 2 weeks, I will refer you to a specialist for heart ultrasound.
Okay,
Okay.
okay.
Thank you for coming.
Thank you, doctor.
Doctor. So next case, doctor.
Okay, other
I think
people.
now there is some background noise. I think.
Give
Yeah.
me 1 minute, doctor. Let me see that there is some new. Okay, now it's fine.
Okay.
So your patient is Mrs. Sarah, 20 years, a 28 years old female, came to discuss her problem with you. Please proceed with history and examination and management plan. Examination is gray.
Okay.
Let's
Dr.
start,
Imran is the
doctor.
last case.
Yeah, start.
Okay. Hello, Mrs. Sarah. My name is Dr. Sumaira. Please tell me what brings you here today.
Doctor, I have had really like smelly diarrhea and I'm having bloating for the last couple of weeks now.
Okay. Sorry to hear about it. Please tell me more.
Yes, doctor. Actually, it started 2 weeks ago, and I get sometimes loose, sometimes greasy and foul smelling stools 3 to 5 times per day. And
Mm-hmm.
I have this tummy pain also.
Mm-hmm. Okay. Sorry to know about it. So please tell me that 2 weeks back, have you traveled anywhere?
Yes, doctor. 3 weeks back, I went to Nepal on holidays.
Okay. So during the traveling, you eat or drink street food, or you took anything?
Yes, doctor. I just took random thing, and I even had water from the normal area there.
Okay. Tell me that right now you are having 3 to 5 stools per day, right?
Yes, doctor.
Um, okay. What is the color of your stool? Is yellowish or is watery?
Mhm. It's normal, but it's sometimes greasy and really foul smelling.
Right. Have you noticed any blood in the stool?
No, doctor.
Any fever?
No, doctor. But I feel
Okay.
fatigue.
Okay. Any vomiting you have with it?
No, doctor.
Okay. Any okay. Tell me that do you have any other complaint beside that?
No, doctor. Except this, nothing else.
What is the
And
date
my
of your last?
appetite is reduced also.
Your appetite is reduced. Okay,
Hmm.
right. Okay. And what about that? In your family, does anyone have the similar symptoms?
No, doctor.
What is the date of your last menstrual period?
3 weeks ago.
3 weeks ago. Okay.
Hmm.
Um, so have you used any medication for this diarrhea?
No, doctor. I just took this oral dehydration solution, but doctor, 3 to 5 times I'm really getting fatigued because of it.
Have you noticed any weight loss?
No, doctor.
Okay. Tell me, do you have any long-standing illness?
No, doctor.
You are not using any medication on long-term basis, right?
Yes, doctor.
In your family, does anyone have the tummy problems, gut
No,
problems?
doctor. No, doctor.
Okay. Do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
What do you do for your living, Miss Sarah, Mrs.
Um,
Sarah?
yeah, I'm a teacher, doctor.
So this condition is impacting your job.
Yes, I'm taking off since every week I'm taking 1 to 2 off because of fatigue.
Mm-hmm. I can understand. It must be very difficult for you because of this diarrhea and fatigue. to go to work. Okay, and what about what is the daily dietary routine these days? So
I'm trying to
you
eat,
don't want to. Yes.
I'm trying to take soft foods and more fluids.
Mm-hmm. Right. Right. So which thing is crossing over your mind?
Doctor, maybe some bug in my tummy.
Yeah, it might be possible. Yes, see, it seems like. And which thing is which thing is worrying you the most?
Doctor, maybe something is a kind of serious bowel disease because I'm really embarrassed and it's very smelly also.
I hope not. And what are you expecting from me today?
I want to test and treatment for to stop this diarrhea.
Sure, I will definitely tell you about it. So, so let's summarize. So, Mrs. Sara, you are saying that since last 3 weeks, 2 weeks, you are having this kind of diarrhea, which is smelly, and you traveled to Nepal, and you are thinking it might be some serious gut problem, and you want me to give you some medication. Is it all?
Yes, doctor.
So, I want to do some investigations also, but before that, I want to examine you.
Sure, doctor.
So, on the basis of complete privacy and chevron, I would like to check a patient general physical do vitals, BP, pulse, temperature, respiratory rate. I will start with the hands. I will check the dehydration, like it's at the capillary refill, anemia, and
Mm-hmm.
in the hands. Then I will check, or I will in the mouth. I will see the any dehydration. I will check the eyes, then I will palpate the lymph nodes. I will ask the patient, could you please remove just put your shirt little up. I want to just palpate your tummy. So I will do the tummy examination. Okay, and I will palpate the tummy. I will check the bowel sounds. Then in the end, one more thing is that since the patient has diarrhea, so I want to check the BP in sitting and lying position, sitting and standing position. Sorry. Okay, and
Okay.
then I will tell the patient that in the end I would like to do your examination of your back passage. Okay.
Okay, doctor. Everything is fine.
Okay. So
So
Mrs.
two
Sara,
minutes left.
uh, okay, Miss Sara, on the basis of your history and examination, what I think is that you have a condition which we call giardiasis. Do you know about it?
No, doctor.
So basically, since you have traveled, so it is a kind of bug infection, in which there is smelly stools. But the good thing is that we can treat it. I am giving you a tablet, a metronidazole, 400 milligrams thrice a day for 10 days. Okay, try to take yogurt, banana, and rice. You can also take the bread diet, which is the banana, rice, apple sauce, and toast. Are you getting me?
Yes,
And
doctor.
meanwhile, I will write some investigations for you, like full blood count, ESR, CRP, electrolytes, and the stool antigen for giardia. Okay, and stool culture and antigen. And if your condition will not improve in 1 week, then you have to come to the emergency, and otherwise you can come after 2 weeks.
Okay, doctor.
Okay, do you have any questions? Do you
And
want to
doctor,
ask?
will it spread? Will it spread to others?
Um, I hope so. It is better to avoid to going at work. It will not spread, but you have to maintain a hygiene before after coming from the washroom. You have to wash your hands thoroughly before eating food. You have to wash hands thoroughly, and that's it.
Doctor, can I cook for other people?
Yes, you can cook for other people, but you have to wash your hands and maintain your hydration. Drink plenty of fluid. Take oral rehydration salts. And if you have diarrhea, I can also write one medication which is la loperamide. Okay.
Okay,
Sign off,
doctor.
Dr. Sumera. Good attempt. First of all, shall we start from the first case? It is shingles, am I right? So, Dr. Sumera, have you asked about anyone is pregnant, a small baby at home,
Oh,
or anyone is a bedridden patient or immunocompromised patient in the house?
no, I haven't asked any other about any other.
Yes, doctor.
Doctor.
Okay. So let me tell you why. Because shingles are having, if like say there is a shingles, so it is not active for those who got it, but for newborn babies, immunocompromised, pregnant ladies, this is a red flag. This is we call it warning signs out there. Okay. Here we have to, um, you know, um, you have to address in different way. Number two, doctor, in the social who is living with you. This way it will be much better to ask. So here, when you're asking about psychosocials with whom you live, any small baby at home, any bedridden patient, anything. So here agenda to see anyone is immunocompromised, then we have to take care of the best for them. Second thing, doctor, simple case always give little bit more trouble than complicated patient. Psychosocially, he was a teacher.
Yes.
Okay, so yes, so we have to give them leave, not to give send him them to work because they are potential to give other people chicken pox. Hmm?
Okay.
Okay. And examination was good, and there was no such thing left. In investigations, we don't go for we clinically diagnose the patient. If, like, say, in case, for example, agenda says that doctor, I want investigation. So here you have to explain that Mr. Khan, already you've been diagnosed on clinically basis that we are facing. We are seeing that you have been you have been diagnosed with shingles. So there, at the point, there is no need of any investigation, any investigation. But one more scenario might arise here, doctor. My father or my mother got shingles. My wife is pregnant, or my child got, sorry, my I have small baby at home, so I'm a bit worried about my child. So agenda will be changed. Okay, so here we have to say that we have to in this patient we have to keep the rash clean and dry. Loose cotton clothing, should not take the shower. Avoid scratching. You given already antihistamine and non-adherent dressing because a lot of people they say that we will cover it up so it will not be spreading. So this is a wrong approach. It might give superimposed infection for the bacteria or some other infections. Avoid contact with the pregnant women who have not had a chicken pox. So you have to ask. Now she said, the SP said that my wife is pregnant. So here you can ask, does your wife got chicken pox or no? Huh? So she will. He might say this. My wife was. She got chicken pox recently, maybe 2 year or 3 year ago, maybe in the childhood. So the story will be changing. Now explain that other can get the chicken pox from him, but not shingle. Okay, because shingle is another part of chicken pox. Safety netting you've gone through.
Uh,
Here, yes, doctor.
Dr. Imran, I have a question. Like you are saying that if your wife if his wife has chicken pox, okay, history of chicken pox, then she will not get the shingles, right?
No, she will not get the shingles. But if, like, say, she don't have she don't have a history of chicken pox, then she might get the chicken pox. This is dangerous for the newborn also for the mother also.
Okay. And one more thing is that if do we need to give acyclovir if like prophylactically to the if she had no chicken pox in the childhood,
No,
then
no. For example, in that scenario, doctor, we have to say that she have to consult her if, like, say, you don't remember anything, tell to consult with the gynecologist or the obstetrician, whatever, whoever is treating the doctor. Okay, so that will be my better agenda rather than saying anything different way.
And one more question is that, Dr.
Hmm?
Imran,
Yeah,
I have seen in past papers that there is a post-herpetic neuralgia cases there. So if
yeah.
in this case the patient is complaining, doctor, I have so much pain, give me medication. So can we give that neuropathic drugs?
Yes, we can give if there is no contraindication.
Okay, in this case.
Yes, yes, doctor.
Acha, okay.
Yeah. So, doctor, your next case was stable angina. Am I right?
Yes,
Stable
yes.
angina, doctor. Mr. Ravi was there. So you ask about onset trigger, and after that you and ask about character, but you didn't. You forget everything and you jump to the past medical history. Are you taking any medication? So here, the beauty of that case must be that we have to complete HOPI spices, like say onset, trigger, character, radiation, duration, frequency, and associated. Hmm?
Okay.
So it
Yes.
was means like say your HOPI was a little bit incomplete. Huh? So,
Okay.
one past medical history, you didn't left anything that was good. Family history, you gone through. Psychosocial, you gone through. Eyes was good. Summary, little bit prolonged in that because here you say that you are Mr. Ravi. You presented with a history of chest tightness in 3 months. Now you think that you might have some problem in the heart and you worried about it might not be it is like your it might be looking like your family or father. Is that okay? Anything else you want to discuss? That's it, doctor. This is only 2 or 3 liners. Mark my words that you have to practice the summary everywhere in less than 5 to 7 seconds, doctor, not more than 5 to 7 seconds. Make it maximum 10 seconds, doctor, not more than 10 seconds. Summary should not be longer than 10 seconds.
Okay.
Because many of us, including me, also I used to do this thing that I was taking a lot of thing to summary because I wanted to make sure that I wanted to show up the examiner that I know each and everything. I didn't miss anything from the patient's data gathering. No, this is a wrong approach. Here we have to take only that simple picky words and picky sentences and put paste in the history and come out. Okay,
Okay.
and yeah. And after that, one thing in this case, you are not letting that SP to complete the statement. Okay, give some time to the SP, so at least you will be getting the important scenario. Maybe SP is going to tell you something important which might you might miss because I interrupted in between the SP. So SP will not giving me give if SP will not give me that exact finding.
Okay.
Okay, one. Okay, so in and in patients investigation, there was things noted from my side. Investigation, yes, you have to do the ECG. That's important. If like say, and you have to ask, are you in the pain right now, or do you have any chest pain right now or chest tightness right now? Okay. Yes, this is the sentence you have to add. And pharmacologically, you have to from our side, we have to offer them GTN. Okay, patient is we have to offer the GTN and we have to tell how to use the GTN and we have to tell exactly how what this is how we are explaining in inhaler technique. Same goes here in GTN. Okay.
Yes.
Yeah, and apart from that, consider you are going to give but beta blocker other thing. But here you can say that I'm going to give you the referral letter for the specialist. Okay, and now pharmacological advice: if patient is smoking, you have to stop smoking and offer support and smoking cessation plan and graded exercise with symptoms limit. This is important. Here, not you here we have to avoid that you have to do the exercise 20-30 minutes. No, you have to say that I'm offer you graded exercise with a symptoms limit. Okay, avoid exertion which provokes the severe pain until it's fully assessed. Okay, and weight loss. If patient is having high BMI, so you have to offer the weight loss and dietary improvement and limit the alcohol. Stress management, if like say patient having stress. Okay, so diabetes doctor very typical and one of the most commonest infection in GI tract or what you call it infectious disease been coming in the exam. Either this diabetes, entablopathy and hepatitis A and E. These kind of cases, doctor, you have to buy heart.
Okay.
Okay, yes, your history was data gathering was good. But again, doctor, patient by profession, patient was um what was the patient? Yeah, patient said that he wanted to cook for others. You have to tell him not to cook for others.
Okay. I have to, say don't cook. Okay.
Yes, yes, doctor, and you have to treat the patient, and you're going to do this. Take this to if you like say sometime examiner will tell you You say that I'm going to take the stool sample for what? I'm taking stool sample for ova and parasites and culture as per our protocol. Then examiner will say that culture is pending, but stool sample routine say that ova and cyst are present for dialysis. So you're going to treat the patient. Okay, but if like the patient having prolonged history, more than 1 month history, so you're going to check the full blood count, urea electrolyte, LFT, and CRP. And doctor, here one more important. I will forget. There is a very interesting scenario that might arise. Mother comes with one full blood count report because I will forget here. Mother is worried that she took this one on the chat GPT. Shows eosinophil count is high. Child is well. Hemoglobin, everything is fine. So what do you suspect of that one, doctor? Anyone having idea what you suspect?
Only eosinophil count is high.
Only eosinophil
Parasitic,
count is high.
parasitic
Yes.
infection.
Yes,
Warm
exactly.
situation.
Here you go. So don't get in confused with that one, okay? Because this is very typical and very complex scenario where everything is positive, negative. Child don't have any problem. Just only child don't have eating habit and child is not growing. But when you see the full blood count, it's very normal. Eosinophil count is high. Okay, parasitic. That is wonderful approach, doctor. So you have to take because I was keeping in my mind this long time, but I was not getting time to tell this guy to you guys because many candidates, one of my candidate, uh, um, he was keep on taking this history, and at the end of the day, he hands up. He said, "Doctor, I can't do it." The reason because here very simple, minute thing is there, but if when we overlook this thing, so we might miss the boat. Okay, and doctor, in management plan, luckily you have to tell that this is a parasitic infection you got from that contaminated water and food, what you eat during that your tour, and empirically, or you are if like say you're going to treat the patient with and entoprotozole, okay, metronidazole you have to give as per the local guidelines. Okay, non-pharmacological doctor, oral dehydration, maintain fluid intake and avoid dehydration, simple low-fat diet while asymptomatic, hand hygiene especially after toilet and before food preparation. Here one thing, how many people live in the house, okay, how many toilets you have and who is cooking for you. These are the three different sentence. These are the three different questions are there you have to ask, and you have to stop the patient. You have to say that you have to advise the patient to temporarily avoidance of the preparing the food for others. The patient is very symptomatic until treated. Okay.
Okay.
If your symptoms are not getting improved within 1 week, I will be seeing you again. Okay. And you can continue if you have to notify as per local guideline again. Okay. I don't know about Dr. Pakistan and India and Sri Lanka and Bangladesh guidelines. But if like say it is there, so you have to notify as outbreak.
Notify
Okay.
where? Public health
No,
department.
public health department, doctor, and safety netting. If like say you're getting high fever, abdominal pain, blood in the stool, come back to us. Or you can say if your symptom getting worse, that's it.
So
So
if the patient is
that
saying,
yeah,
doctor, the patient is saying, doctor, I don't have any extra toilets at my home. I have only one toilet. There are five people in my home.
uh-huh.
Okay, and there is no one to cook for me. Then
Hmm.
yes.
Doctor, here you can say that you have to wash your hand properly, okay? And touching the knob, it should be, you can use some sort of, you can use the gloves while doing that one. Or if patient is very poor, so you can say wash the hand and after that put the water on that, a knob, okay? And that way you can treat, okay? Means like say you're going to think as a psychosocial also, patient, psychosocial status also, so you can use the word that you have to wash. But if like say mother is there and she's having dialysis and she's getting the problem, so here you can say that yes, Mrs. Khan, I can understand your concern. For meanwhile, if like say it is not possible, so you can cook your children cook food for your children. But before that, make sure that you're using the clean utensils and warm up the utensils properly. Okay,
Or
heat up
doctor,
or warm up the.
we
Yes,
can
Doctor
tell
Hamza.
the husband to cook.
Doctor, yeah, it is possible in here in Middle East, but I don't think so in Pakistan it will be possible. But
Yeah.
Yes, of course, doctor, we can say. Is there anyone can cook for you? Yes, this is a good question you can say. But again, doctor, you can say that you use and you should not use, you have to wash the vegetables and you have to boil the water. Okay, because we are talking to talking to the person who is in third world country like say Pakistan or South Asia. So where we have to address this thing that you have to take care of boiled water. Okay,
Acha,
and
one
you have to separate your utensil, food utensil, like say your
Sure.
utensils, like say where you eating, sharing of the food.
Okay, separate food reason. Okay. And one more thing is that since how long we can give him the sick leave? So for 1 week sick leave or
Doctor, till symptoms resolve, like say 1 week we will be giving and we will review again.
okay, okay.
Yes, doctor, from your side, your input I have given.
Okay, Dr. Sumaira, for the first case, you asked for neck stiffness. Why?
Because it was rash, I thought there meningitis to roll out the meningitis thing.
Okay.
I should not be in the
Hmm.
I should not think like that, but बस पूछ लिया बस मैंने मतलब
Okay. Pain,
yeah,
pain score was missing. And also pedal edema you did on the examination.
yes, I did.
Uh, yeah, but I don't think so it's needed here. That's why I was asking, was there something to like rule out with the pedal edema?
Okay,
And
sure.
it's good that you only inspected the wound, you didn't touch it. Okay.
Yes.
And stable angina, the differentials wasn't ruled out like acidity, like her GERD symptoms, any trauma or pain increasing while inspiration to rule out pleurisy.
Actually, I didn't touch the Socrates now. That is why.
Hmm. Hmm.
Okay. So pain increasing while respiration, and what else?
During breathing, there's the pain increases and trauma, and also GERD symptoms like acidity or reflux.
Okay.
And most importantly, when you're prescribing GTN, tell about sildenafil use. Don't use sildenafil within 24 to 48 hours between. And if he used it already, then don't take GTN
Hmm.
right away. Come to emergency within 24 hours for sildenafil and 48 hours for tadalafil. Okay.
Okay. Okay.
And for the giardiasis, you asked about the color of stool. So here we ask consistency of stool and not color. Color is only when hepatitis or jaundice are considered.
Okay.
Otherwise, it's fine, up to the mark. Okay.
Okay. Dr. Imran, you told that in one child the mother had complaint of increased eosinophil count in the full blood count, and that was a parasitic infection. So parasitic infection are of so many types, right? So how will we treat in that case? Then we will examine the stool examination, na? Stool for ova and
Yeah,
microscopy.
yeah. If like
Okay.
so, you say stool for ova, they will be saying helminthiasis. Okay, this case will be a helminthiasis. Okay, helminthiasis case again. You have to deal with bendazole or albendazole.
Albendazole, no?
Okay, yes. Okay,
Yeah.
so you have to treat, and you should know that how to treat that one. Okay, and doctor will be taking advantage of 5 minutes remaining. There is a one case in 2025 May exam in Karachi. I think we have discussed before, but again, I'm going to repeat that. That case was having dual agenda. Dual agenda in a way that that lady was sitting with one report and she said, Doctor, I am having this report with intermepa histolytica. Okay,
Mm.
it's positive. I'm a bit worried about. Can you tell me about the report? Doctor started explaining the patient and SP, and suddenly he just flipped the page and he found out that there is one more report is down. Okay, which was showing that patient had hepatitis A 6 months ago. Okay, For example, if you saw only one report over there and down there is a one report, don't underestimate that report. That might be the agenda of the whole case, because that was a hepatitis A mixed enterobiopathy histolytica. So how you going to treat? Patient was treated, now patient came for further. So now you're going to treat with OVA. Okay. Now, and we have to see what kind of profession she's having. She was working in a restaurant, and she was working on the cruise or working in the resort. Okay, since you're going to Sri Lanka, so that agenda will be coming as, it might come as, will be, I'm not using because I'm not the scenario giving person. So that might come as patient working in a resort or some cruise because of tourism over there. Okay, so just make sure that you are taking proper history and looking at whatever investigation given over there. So you have to look thoroughly, and after that, you have to explain about the details. Okay, so Doctor, thank you very much for joining, Dr. Sumera and Dr. Amreen. Good
Thank you,
attempt.
Dr. Imran and Dr.
It's
Mustafa.
you guys having good potential, and inshallah you can do it. There are few things that are, doctor, small things. Everyone do the mistake. Okay, no one is perfect. Even though if you give me the case, also I will be doing some sort of plus minus thing. That is a normal thing, because here what I call it, if you are able to do the case in front of the crowd, there you will be doing very good, way. The reason here you have courage to talk in front of the crowd.
Yes,
Okay,
yes.
that very few people having this quality. Okay, so take this as a advantage, as a advantage. So practice. Okay, when you practice in front of the crowd, you will not be getting the mistake. For example, if I am doing the case in front of the crowd, I got the mistake. So someone corrected me. It will be lifelong, will be written on my brain. Okay, rather than I will be taking as a something what happened in front of other people. Someone giving me someone corrected me. No, doctor, someone corrected your mistake. That is a wonderful thing. At least you corrected at this point, not in real exam. In a real exam, no one is going to correct you, doctor. Okay, so I really appreciate those who took the courage, and that is a really um, encouraging for us also to continue the sessions. And tomorrow again, Dr. Sumera, you are there, and Dr. Saima will be there, so we'll be taking care of them. And after that, Dr. Sanobar and Dr. Saima is there. So inshallah, we'll be doing every day three cases. Those cases will be from high yield cases. High yield cases, like say, most commonly came in the exam. So it will not be normal scenarios. Please take care of that one. So inshallah, see you guys tomorrow. At time we will be explaining. We will be sharing you tomorrow, inshallah.
Dr.
Okay,
Imran,
thank you.
may I ask a question, please?
Yes, doctor.
Regarding stable angina case, if the patient comes, we told him everything, GTN use and sildenafil contraindication, everything, and ECG was done, so it was diagnosed as unstable angina. Then should we call him for follow-up, or should we refer him in 2 weeks referral to specialist?
So, doctor, I'm not getting your question again. So, sorry.
Doctor,
So in
I
case
get
of
it.
in
Like
case of
we
stable,
will
Okay.
refer for 2 weeks. Yes, for echo
okay.
if needed.
Hmm.
But it's
Hmm.
not it's not urgent follow-up. You can delay it for
Hmm.
like 6 weeks even.
So the
But
treatment
we
of
have
stable
to
and
mention.
unstable angina is same, na? There is no difference.
No, there is different. Unstable is likely STEMI or non-STEMI.
Because
Okay.
for unstable angina, we need a same day referral. And for example,
Yes.
if the patient come to us right now, he has no chest pain, but his last episode of chest pain was around 12 hours ago. So even then, that patient needs to be referred same day.
Yes.
Yes.
Okay, one more question regarding asthma station. If there is peak flow expiratory device on the table, should we ask patient to teach the patient to do like this, or we will only hold the device in our hand and tell that I will check this for you, and you have to monitor your symptoms while using this device at home?
Okay, doctor.
Tell him to
Uh,
blow into it.
Yes, doctor. Here you can tell him to blow, but in my case, it happened. Exercise-induced asthma patient was there, and they asked me. So I just touched the device, and I said that I'm going to give you this device, and here you have to blow. And examiner giving me this statement that since you touch this device, I'm giving you the reading is normal 400. Okay, so
Hmm.
here you are not patient is not going to perform it, and patient is not going to do anything. But they know that you know about this device.
Hmm.
Same goes to
Hmm. Hmm.
doctor. Your urine dipstick.
Okay.
Why I'm
Hmm.
talking about urine dipstick, many candidates they lose the marks on that one because they don't know about urine dipstick in urology
Hmm.
cases or pregnant lady cases. Doctor, even pregnant lady is there. I
Hmm.
came for a discussion, even though she came for diabetic reporting. But you say that I will be doing
Hmm.
checking your urine. The reason because I wanted to see
Hmm.
about urine health.
Hmm. Hmm. Okay. Hmm. And also at asthma stations, sometimes I'm not sure, but other than inhaler, peak expiratory flow, anything else could be on the table which we need to address.
Doctor, nothing will be there. Only asthma. There will be only that this thing.
Hmm. Okay.
Medications, medication.
And medication will be the doctor. Like say maybe patient
Hmm.
having steroid with him, maybe having montelukast, maybe some antibiotic he's taking. Some agenda will be there to know about how to
Hmm.
address. Maybe overdose, over
Hmm.
usage of antibiotic.
Hmm. Hmm. Okay.
Okay, doctors, thank you very much. See you
Hmm.
guys
Thank
tomorrow. So
you.
we'll be sharing tomorrow. Okay.